UltraShape is a way of contouring the body by melting the fat using focused ultrasound beams. It's a system where you use a series of ultrasound beams that converge about an inch underneath the skin, and it jostles the fat cells until the cell wall breaks. Once the cell wall of the fat cell breaks, the fat leaks out into the lymphatic system, gets drained to the liver, and is metabolized there. No, it's very important to note that the UltraShape is not a weight loss device. You can use it, however, as a targeted fat loss. The problem is when you lose weight, you lose 5 pounds, it's very hard to choose where the weight comes off of. So when you lose some weight, a little bit comes off the face, a little bit comes off your chest, a little bit comes off your arms, and you really can't choose. With the UltraShape, you can specifically target an area that you want to melt the fat from, such as your muffin top or in the arms or in the thighs. You can actually choose that area and melt the fat off there. What I'll tell patients is that after treatment, what they should do is put themselves into a sort of a negative calorie state. You don't need to lose weight, but after treatment, please eat very, very carefully, put yourself into a fat burning state. Now, when that happens, the liver is going to take the fat and break it apart and turn it into energy. But presto, you've actually just had the UltraShape, you've delivered a big bolus of fat to your liver, and the liver will actually metabolize that fat. And in that way, you can selectively choose where you're going to metabolize fat from. UltraShape generally is not uncomfortable. It is a bit of a long procedure, lasts about 2 to 2.5 hours, and so patients may get a little bit antsy towards the end of the treatment. It hurts a lot less in laser hair removal, more in the sense of almost like a pen that's sort of jiggling and poking. That's more the sensation that you get. There's no downtime, so you can continue on with your regular activities the same day. UltraShape and Zerona are both body contouring systems. UltraShape uses ultrasound, which has been a technology that's been around for a long, long time. We've been using ultrasound since the early 60s to break up kidney stones. So if you've been unfortunate enough to have kidney stones, we'll immerse you in the bath, and we're still doing this now, bombard it with ultrasounds, and that will actually vibrate the kidney stones until they crumble. So UltraShape does essentially the same thing, except that they're more focused and we target it towards fat cells. Zerona uses a low-level laser therapy, basically a 635 nanometer light, to break apart adipose tissue. The problem is that there really isn't a lot of scientific evidence for the Zerona. Most of the studies that have been done were done on fat cells that were taken outside of the body, and the 635 nanometer light was shone on it at that time. So, there just is much more scientific evidence for the UltraShape compared to the Zerona. One other thing that worries me a little bit is that that wavelength is actually commonly used for laser hair stimulation. And in those situations, for that laser hair stimulation, we'll actually use more powerful lasers that has greater output into a smaller area, and we'll apply it for a longer period of time. And we still don't see any fat atrophy in those situations. And so that's one of the things that worries me a lot about Zerona. I'm not really convinced about the scientific evidence behind it. You'll need 3 treatments 2 weeks apart. If you don't gain weight, the fat won't come back. It's important to note that the fat cells, in fact, are very, very hardy. Even though you've cracked the cell walls, they are still alive and well. And if you gain weight, they're ready, willing, and able to plump up again. But if you manage to keep the weight off, the result should last forever.